Hi ladies, so I just filmed this and the audio was like all off and funky, so I'm going to try to make this quick because I don't have time to do another vlog. I'm getting my list out here of things to tell you about, but today let's get some better light here. I am 39 weeks and 6 days. In a couple of hours I will be to my due date. So that's different for me. I've only ever made it to 39 weeks, like in 0 days. So I'm a week pregnanter, more pregnant than I've ever been. So let me tell you what's been going on since I talked to you last, which has been about a week and a half. When I have contractions, it feels like my body's actually like bearing down and pushing, which is weird for me, but you know, it is what it is. So, I have some contractions I can't walk through. I've been trying to keep active and busy. We've been like hiking or going to the zoo or going on a walk every day, things like that, or going to the mall if it's too hot so we can walk inside. And I've been walking every day. Now, the days when I walk a lot, I notice my pelvis really hurts at night. It almost feels like it's mostly my left leg. Feels like it's loose from my hip joint, and it's really uncomfortable. And it only hurts, it's a functional pain, so it only hurts when I go from sitting to standing, or if I'm standing and I start walking. If I sit still, it doesn't hurt. If I lay down, it doesn't hurt. If I'm standing, it doesn't hurt. Basically, it hurts with movement. So I did go to the chiropractor, and he kind of fixed it up, and it's been better since then. But if I overdo it, I feel it. So, and the pain, if I don't go to the chiropractor, it lasts about 2 days, and then it goes away. But within the next 2 days, I'm going to be active again. So it's kind of like I get a little relief, and then we go do something else, and it starts hurting. So, yeah, that's been going on. For days now, I've had contractions that are about 20 minutes apart. They're painful. I can't walk through them. I have to focus on them, but they're not getting stronger. They're not getting closer together. They're not getting more regular, nothing like that. So, it is what it is. I did try to do some optimal fetal positioning type things to try to help baby get into a more desirable position if that was the holdup on why labor wasn't starting. So I don't know. It didn't put me into labor or anything. But it's been about a week since I did that, so I may do that again sometime soon. At my last appointment, which was last Thursday, and it's Sunday now, I was 2 to 3 centimeters dilated, 50% effaced. My cervix is moving anterior, and his head's very low. She said, you know, she can feel his head when she examines me. And she said, like, when she would touch his head to make sure he was head down and that was a head that she could feel, the baby would move away. He would move away from her hand. So I don't think he's engaged because he can still wiggle away. But he definitely, his resting position is low in the pelvis. And then since I have made it to my due date, essentially, I'm starting non-stress test and also having a amniotic fluid index ultrasound next week. My NST is on Tuesday and the ultrasound's on Wednesday. And I'm a worrywart, so I'm fine with the extra monitoring, just to make sure that he's still okay. I've never like hit my due date or made it past my due date, so this extra monitoring is kind of new to me as a patient. I have plenty of doula clients who have had to do all of this, but yeah, I don't know. It's my turn now to go overdue, I guess. You know, you're not overdue until you're 42 weeks or more. So, you know, I'm just hitting my due date. I'm well within like the normal range of like we can go into labor. But I personally, I would like labor to start sooner rather than later because I have big babies, and I had big babies at 39 weeks. So I know they don't gain too much weight in these last weeks, but I don't know. I still don't want to have to deliver a gigantic baby. So if that can be avoided, that would be good. I have a feeling I've made more progress since my last appointment, but we'll find out for sure on Wednesday. I've definitely still been losing mucus plug. I had some spotting earlier this week, but it was minimal. And regular contractions. I did have a night where I had an hour out of nowhere. Contractions were 3 minutes apart. Like I had one, and 3 minutes later I had another, and another, and another. Like that's just the pattern they took on all at once. But they weren't painful. They were only pressure, and so I didn't even think anything of it because I know what labor contractions feel like, and that wasn't it. So I did not have to work through them. They were short and close together, but they weren't painful. So, not in the least painful at all. So, yeah, I guess that's the happenings of the past week and a half. So I will show you the belly, and then hopefully the next time I see you, I will have a baby. But we shall see. I feel like I wear this shirt in all my videos. It's one that still fits me. Probably wear it once a week, and I guess it just happens to be on days when I film vlogs. I promise I don't wear this every day, but I'm not going to go change my clothes to make a vlog when I have a minute. So let me show you the belly, and that will be it. Here's the belly. In the side, in the front, other side. Ta-da! There you can, it's too bright. You can see the belly there. Front. Sorry about the lighting, it's awkward. On the other side. There's a big boy in there, I can feel it. Alright, thanks for watching, and hopefully next time you see me, I will have a baby. Bye, guys.